how your practice is different?
Yeah, I mean, I think if you look at traditional pain management, most people, when they hear that, they think a lot about, steroid injections, radio frequency ablation, a lot of physical therapy. Those therapies don't work. Then, you're getting referred to a surgeon for surgical evaluation, spine surgeries.
Stem cell law that passed in the state of Florida.
Florida is not. So the bill, in essence, allows the use of stem cells.
Do you use social media to grow your practice? What could go wrong with, what's going on if it's not used properly? One of my mentors says, listen, welcome back to The Shift, from limitation to liberation. I'm your host, Dr. Vega. Today's episode, we have Dr. Ankeet Choxi, Interventional Pain Management Physician based out of Miami, Florida, founder of STEMS Health. How you doing, Dr. Choxi?
Good morning, Gil. Great to see you. Doing great, man. Happy to be here.
Absolutely. I know it's early on a Saturday morning. I wanted to bring you to the show just so we can go over a little bit about your past, so you can tell us about how you got to where you are today, talk about the business. We can bring and talk about also the new stem cell law that passed in the state of Florida, where you see that going, and try to give some advice to people, that other providers that are stuck, they're working on W-2 for an insurance company. They're just spinning their wheels. They have no control of their time or freedom, and they kind of want to start their own thing, but they just have no idea. So hopefully with, some of these conversations, we can motivate some people to take action in their dreams. So I know you have a very really good training where you train. Can you tell us a little bit about where you do your medical school and then postgraduate training and fellowship?
Yeah, absolutely. So I went to medical school and undergrad at Vanderbilt University in Nashville, Tennessee. And following that, I did my residency in anesthesiology at the University of Miami, down here in Miami, Florida, what I call home today. And following that, did a pain management fellowship in interventional pain up in New York for a year at New York University Langone Health, or NYU. So kind of bounced around everywhere. And, for the past now 6 years post-training, I've kind of made Miami my home and where I choose to practice and build my business.
That's awesome. So tell us a little bit about your practice. So what do you do? I know so your background in anesthesia, then interventional pain. But I know your practice is a little bit different than a traditional interventional pain management clinic. Can you tell us a little bit about how your practice is different?
Yeah, I mean, I think if you look at traditional pain management, most people, when they hear that, they think a lot about, steroid injections, radio frequency ablation, a lot of physical therapy. Those therapies don't work. Then, you're getting referred to a surgeon for surgical evaluation, spine surgeries, joint surgeries, whatever it is. And, I still do a lot of traditional pain management. I see a lot of patients that come to me, and, the best option at that time is possibly a steroid injection or something of that nature. But I would say a few years ago, I suffered a back injury myself, a low back injury, herniated discs, had radicular pain. And I kind of went through that sort of, I don't want to call it algorithm, but process of epidural, steroid injections, physical therapy, rehab. And I got better. It just took a very long time. And it was a lot of, hours of work and anxiety and stress in my own head about if I'm going to get better, if am I going to need surgery. And it kind of led me down this rabbit hole of research, exploring of what can I do more for not only myself, but for my patients. And it kind of led me to regenerative medicine. And, for the past, I'd say now 3 years almost, maybe a little bit more, I've really dived deep into alternative therapies, things like PRP, stem cells, and other therapies to not only help my patients reduce pain, reduce inflammation, get them functional, but also to help restore and damaged tissue. To get them longevity in their joint health, their spine health, their overall well-being and health. And so now a large portion of my practice and what STEMS Health focuses on primarily is regenerative medicine. We do a lot of orthopedic injury. We do general wellness, peptide management, IV therapies, a lot of different things. But our main focus and what we really pride ourselves on and think we offer the highest level care for our patients is in orthopedic regenerative medicine.
Yeah. For people that don't know, with regenerative medicine, traditional pain management, even orthopedics, right? You're treating steroids, cortisone, which is what was being done for years. And we're starting to understand how the steroids are toxic they damage tissue, they accelerate the breakdown of tendons, arthritis. So we try to concentrate on alternative therapies, like you said, using stem cells, platelet-rich plasma, which is going to it is going to promote healing, decrease inflammation, improve function, which is what you want to do while preserving the joint instead of like worsen it over time. We're going to deep dive into the practice, but before that, I wanted to go back to, so you finished, you went to Vandy, did your undergrad in medical school. Huh? Yeah.
Go Doors.
Go Gators. And then and then you went to University of Miami for anesthesia and pain management in New York. Now, most doctors, well, I don't know most doctors, but a lot of doctors, when even in fellowship, most people sign a contract. I got to sign a contract in my fellowship working for health insurance. I know you didn't go the traditional W-2 route right after fellowship. You went into, I know we talked about different couple roles, and I'll have you talk a little bit more about that. And what was that decision, or why you chose to not just get a traditional W-2 job, but do your own thing?
Yeah, that's a great question, and I think that's an important thing to discuss. Especially for a lot of your viewers probably listening are interested in hearing how to make that transition, why people go directly from not don't sign contracts with large groups or practices, because I think that seems like the safe bet, right? You go through medical school, you go through training, you see all of your friends and colleagues sign contracts. Everyone's talking about their signing bonus, relocation bonus, CME travel, everything like that. In residency and fellowship, let's be honest, you're making $60,000, $70,000 a year, if that. You don't see much money in your bank account. You don't much see savings, and someone comes along and offers you a contract for whatever it is, 200, 300, $400,000, and that's more money than you ever think you're ever going to make in your life. And so it's very very tempting to sign those contracts. It's just when I was in fellowship in New York, I just still believe New York's kind of the land of opportunity, and if you really want to hustle in New York, you can achieve a lot. There's a lot of opportunity up there. And during my fellowship, I was lucky to get introductions and do some moonlighting outside of my fellowship for anesthesiology. And so I functioned as a 1099 contractor outside of fellowship. I did a lot of moonlighting anesthesiology, nights on the OB floor, weekends in a hospital. And I quickly learned, like, wow, I can make money very fast without an actual contract somewhere. And so when the time came for me to sign a pain management fellowship, I went through the process. I took recommendations from my chairman at NYU, my pain director at NYU. I interviewed with people in New York, Georgia, Miami. I really put the effort in. But at the end of the day, when they sent that contract, that PDF for me to read, there's just so much language. I just did not feel comfortable signing something. Non-solicits, travel restrictions, non-competes, limited time off, all these things. I was like, this just does not seem smart for me, because I know I have a way to earn income as a 1099 contractor already right out of fellowship like that, have freedom in my schedule, have ability to pursue other things, whether that's work related, business related, travel, family, friends. So for me, I just decided, I don't feel comfortable signing these contracts. I feel like I'm going to get taken advantage of. I think the statistics at that time were something like 80% of physicians changed their job within the first 2 or 3 years out of fellowship or residency. And to me, that was a staggering number. 80% of people are not happy. They sign a contract just because they feel that's what they have to do. And for better or worse, I've always been someone to kind of buck the trend. And so I said, no, I'm not going to do it. I'm going to try to carve my own path, see where it takes me. And, at the end of the day, if it doesn't work out, if I am not hitting my income goals, if I'm not where I want to be, if I'm not happy, those jobs still exist all over the country. Hundreds and hundreds of people are looking for W-2 physicians to come in. And, I had that as a fallback. But, I just kind of took a bet on myself, said, let's do it. Let's see what happens. And really haven't looked back. It wasn't easy. A lot of my mentors told me I'm going to ruin my career. The gap in my training, if I don't take a job, people are going to look at that poorly. And I just refuse to believe that. I feel if you do everything properly, you treat patients the right way, you do things ethically, opportunity will always be there for you to be successful.
Yeah, I know that's very different than straight out of school, because, like you said, people want that, I signed a contract in my second month in fellowship. I signed a contract, which I was with that company for 2 years, but then I venture in on my own. I built something small while I was working at W-2, so it wasn't like a complete transition. So when I got out of the W-2, then I was able to continue with the other. So I have already something going. So it wasn't like cold turkey starting. Did you have were there any were you scared? Do you have any doubts? Do you have any limiting beliefs that you're like, what, I'm gonna try to do this, I don't know if I can? Or like you said, you're like, I'm just gonna go for it 100%, I think I'm gonna be able to make it?
I think I was lucky in my training that I did anesthesiology, because anesthesiology is a unique field of medicine. Gil, what's your background? What's your training background?
So I did a year of general surgery, and then I realized that's not what I wanted to do. So I did family medicine for 3 years, and then I did a fellowship in sports medicine afterwards.
Awesome. Yeah, nice. I mean, so it's our backgrounds. Everyone has a different background, but there's a few fields of medicine where there's a lot of locums per diem work available nationwide, anywhere you go. And so things like anesthesiology, emergency medicine, maybe radiology. Recruiters are actively calling you every single day, like, hey, this hospital needs coverage, this OB floor needs coverage, these are the rates. And so I knew for me to take that risk, I would have work. I'd be able to fill my schedule and do jobs. And at least with anesthesiology, it was a fallback. I could go anywhere and patients were waiting for me, equipment was waiting for me. I just had to show up and do my job. And so that kind of gave me, some leverage to say, I don't have to rush into building a practice that's robust and busy. I can always use that as a fallback and slowly take my time to build something, really explore what I want to do, where I want to be, and not be rushed into decisions. But yes, not everyone has that opportunity. I think it was great to hear you were able to build a little bit on the side as you were in your practice. I think a lot of physicians are probably scared to do that. I have colleagues I talk to every day still that want to do something. They just feel like they're worried about that restriction in the W-2, like, a non-compete, a non-solicit. If the practice finds out, they're going to send their lawyers after me, and I don't know how to handle that. I don't want to have that stress. I don't want to lose this job. So, being able to carve that out is, important.
Yeah, and it's that's true too. Like I was really lucky that my contract with my employer, they did not have a non compete. So that was a good thing. But no, I know friends have. I knew friends that are GI dogs that work for a company, and they stop and they literally have to do locums, like I don't know how many miles away, because they, for a couple, like 2 years, they had a non compete, in the area. So that, yeah, that's one thing too. If you don't have a non compete in your contract, I think finding an office space to rent, like a room, like I did, and then 1 day a week start building that patient panel volume. So then when you're ready to go, you already have that there. Um, now,
You made a great point there, and something we should, just touch on are these contracts with non-competes. I think a lot of practices, when you're signing, are either physician owned or at this point private equity, or a bigger conglomerate owned practice that you're coming into as a W-2. Um, I will say, they don't teach us business in medical school. They also don't teach us law in medical school. And these contracts can be cumbersome and, sort of fearful for someone coming in. You got a 20-page contract with all this legalese terminology that physicians, we're smart. We don't truly understand it. We can research it. Um, but, something I did early on was really find a good healthcare attorney, someone to really advocate for me. And these contracts are, it's expensive. You got to pay the attorney. They don't come cheap. But they can really advocate. And if you feel strongly about taking non-competes out of contract, like, something we don't understand physicians, everything is negotiable. Everything can change in a contract. So you don't have to sign something you don't want to sign. If they want you to work there, they should be able to make some, adjustments in their wants and needs as well.
it's funny you mentioned that, because now that I took that entrepreneurship route, like you said, everything's negotiable. Everything, if you look at everything is a contract between two people, and you can change terms. Some people might not be willing to change them, but the worst thing you can do is get a no, right, if you ask. um, so um, I know that another problem that a lot of people have is that like we mentioned, they're burnt out. You know, they're tired of seeing 40 patients a day, 10-minute visits. You know, you have to, you're a physician, you train for so long, and you have to ask for a day off, right? Like you have no control of your time, and freedom. And a lot of people want to take that leap to start even their own, not even their own practice, but even a business, a side business or anything like that related to medicine or not. But they don't have any idea what to do because, again, they don't have a business background. We don't learn about business in medical school. You don't know what an LLC is. You don't even know what the first steps are. And a lot of people, some people might start researching because all the information is out there. You got to look for it, but they just get this analysis paralysis where they want to know more and they want to know more. It's like, I want to learn a little bit more before I take action. I want to learn a little bit more before I take action. And they just get stuck in this hamster wheel, and they don't go anywhere. I mean, I know you had a little bit, I think you looked into business, and I think you took some courses. Can you tell us a little bit about kind of what were your first steps? You know, setting up an LLC, bank account? Did you do the courses? Did you do some courses for business before you started, or did you do it while you were starting?
Yeah, I mean, listen, it's a steep learning curve when you jump in. It's something you're never taught, and not you just told. Here's your check, taxes are taken out. You know, invest in your 401k and keep chugging along in life. But obviously, when you start talking to people outside of medicine, you understand there's a whole new economic world that's out there. I was lucky in my residency. I mentioned the healthcare attorney to a healthcare attorney at that time who I still work with and is a great friend of mine, Max Adams, at the Medi Law Firm based here in Miami. And he's whole passion is truly advocating for physicians and breaking this trend of W-2 jobs and pushing people to 1099. So I really listened to him a lot in residency. And so I was kind of set up for success just from advice and conversations and dinners with him. You know, I got myself incorporated pretty early in fellowship. And, you know, and then it's just, yeah, learning. You just got to read. There's lots of books. There's a lot of literature. We have things like, you know, Chat GPT and podcasts like this and YouTube that if you just put a little bit of time in terms of the analysis process, yeah, at some point you just got to go for it, right? You just got to be like, I've done everything I can, find a good mentor, like just go for it, get yourself incorporated. I say the first thing is just make your LLC. Because once you have that LLC, everything seems a little bit more real. Like, oh, I have a business now. Now I can open business bank accounts. I can get a business credit card. I can start taking some tax deductions against this business, even if I'm not even doing anything, you know? So um, I think that's the biggest thing. And when you have it, it's tangible. You get this name, you understand, you get a credit card with your business name on it, and you're like, all right, this is something I'm moving forward. And then, you know, it's just a building process that takes a lot of time, step by step, to kind of get you where you want to be. I think a lot of individuals, myself included, when I started, have this expectation that we have to go from 0 to 100 overnight. Um, you know, because we see a lot of Instagram and social media and other physicians posting, and you know, people only post their success stories. They don't post the grind and everything they're doing and Saturday morning podcasts like you host and things like that. So, um, you know, I think people just need to realize it takes time. It's not going to be easy, but if you work in, you know, you're going to get where you want to be.
Absolutely, yeah. It takes, I hear most people say it takes about a decade, right? It takes a decade of grinding to get to that point where, you know, like with me, I'm trying to do this. I was trying to grow a practice. We've dived a lot into aesthetics. So I'm trying to, while we have the wellness part of it. And it's funny because when we started doing all the regenerative medicine, a lot of people, a lot of our clients started asking us about GLP-1, right? Weight loss meds. And, you know, I did my bachelor's at UF in exercise physiology. I was a personal trainer. So that's like my background from before. So I understand exercise, I understand weight loss, and a lot of physicians don't, right? So a lot of these weight loss clinics, they put these patients on GLP-1 meds, and that's it, right? They just put you on the medication, you leave, you lose weight because you're starving yourself, but you're not learning anything. So when you stop the GLP-1s and you start getting hungry again and you go back to eating the way you were, you regain your weight back. But now you have a lot a lot less muscle mass because you have atrophy from like starving, right? And that led into, hey, a lot of our patients in weight loss asking about aesthetics. So my wife went back to school. She became a medical esthetician, and we're incorporating a lot of that into the practice too. From a business standpoint, is to me the way I see it is all the services are services that I can add as extra revenue to the practice that I don't have to perform, right? That are delegated to a medical esthetician, in the near future a PA or an MP, right? Again, just bringing more revenue to the practice. So but I'm looking at other ways to diversify the practice where I can add other services that um, I don't have to be the one doing them, right? Because at the end of the day, from a business standpoint, too, is and one thing that I talk to a lot of other physicians that have like business acumen is like, listen, you also want to add services that you don't have to be directly linked to them, because then your income potential is limited. Right? If you're trading time for money when you're doing a procedure, I mean, the only way you're going to be able to make money is keep increasing the price of the procedure, but you can only do that so much, right? Again, there's no more time, so what other services can be added? And that's the kind of like the another thing that I'm doing to the practice. So again, continue doing the regenerative medicine that I do, but then adding some, and then a lot of those patients might want, if you're treating female athletes, right, for like a joint pain or anything like that, they might be interested in all the other procedures, and they already like you and know you, right? So they're already familiar with your practice. They might just stay for those other services with you too. Um, but so as far as like,
What you touched on is just organic growth, right? It's just getting a foot in the door. And as long as you're doing something, other service lines, other verticals, other offerings in your business will naturally come. And I think your customers and clients will tell you kind of where to put your investment and where to do it based just on conversations you have with them. Because, yeah, I mean, we live in an age of digital media, information is robust. I think patients are more and more well informed of what alternative treatments, therapies are out there, and we often have it. They come in the door asking for things, and so and once your foot's in the door, once you get going, it's very easy to add on all these ancillary services to a practice and slowly grow it out.
absolutely. I know you brought up social media. What do you use social media to grow your practice, to get leads into your practice? What are your thoughts on like social media?
It's a good question. Yeah, I mean, I think social media. My thoughts on social media are it's obviously a necessary, not evil, but a necessary sort of thing you need in in your practice and business. Currently for STEMS Health, to be honest, we're not doing a lot of social media. It's on our radar for coming up for end of this quarter in 2025 to kind of pivot and do some more social media. I mean, obviously doing podcasts like this are great. We get clips, things we can use for the future. Right now, our goal is to build a lot of digital assets, whether that's through podcasts, blogs, some digital PR that we're doing. And then once we have those assets ready to deploy, kind of do a more full scale blitz of sorts with social media. Um, yeah, you have to do social media, right? You have to have presence. Patients are looking you up on Instagram, TikTok, whatever it is, to see what you have, and attention span is short. I would say, right now our marketing, the best referral we get is word of mouth. We have a lot of clients that refer friends, refer families, refer colleagues, and we're successful in that regard in trying to get word of mouth referrals. And then also right now doing a lot of SEO. So just, making sure we trend the highest on Google. If someone looks us up, we want to make sure we are the top, that we are directing the conversation and where they're clicking and where they're going, and giving us a lot of metrics on what people are looking for in terms of their searches. We're a little limited right now in, in marketing on Google, and we can dive into this with the new Florida bill. But Google, Meta, and Instagram, Facebook, they still look at regenerative medicine as experimental. So they don't allow us to really market how we want to. And so that's why we haven't made that investment into sort of meta marketing, which I think there's going to be a little bit of a switch. We're speaking to a few healthcare attorneys, people, about what we can do in terms of marketing with the new bill that's passed. How do we establish ourselves and, kind of say, even though on a national level, these are not FDA approved or federally approved treatments. The state of Florida has said yes, and you should allow us to advertise to the citizens of the state of Florida. But that's a whole different podcast, whole different topic. And um, but I'd say right now word of mouth referrals are great, and then we've been doing well with our just Google searches and search engine optimization.
So the new thing now is going to be AI, right? So I was going to ask you. So you want to? I've been doing a lot of research into the AI side, and that Google is going to be phasing out. I mean, that's like what they expect with the AI, because a lot of people are turning more into like chat, one of those chat boxes to search, right? So how you can instead, and it's funny, I was listening to a podcast yesterday, and the guy is an expert on it, and they asked him, he's like, well, they call it like Google like SEO, what are they going to call this? Like, well, there's not a name yet, I'm sure something will come out, but where you want to be optimized for like a AI, like either a Chat GPT or Gemini. I know Gemini is backed by Google, but because a lot more people, and I barely use Google anymore. I barely use Google anymore, and I know that that's where the trend is going to go in the next 5-10 years, where people are going to be phasing out of Google, and it's going to be more of a, you're going to go to Chat GPT, and he's like, hey, who's the best regenerative medicine interventional pain doctor in Miami, and it's all going to be based on. And I even tried it. You can even try, go to ChatGPT and type that and see if you come up. And if you don't come up, the cool thing with, one thing that you have to learn with AI is you have to not just use it like a search engine, but you ask it questions, you prompt it, right? So if you go, hey, what's the best interventional pain management doctor in Miami that does like stem cells or regenerative treatments? And if you don't come up, let's say for some reason, and it will give you like five other options, then you ask Chad, it's like, hey, so what were these results based on? Why was this? And then you can say, why was Dr. Choxi not mentioned in the top five? And it'll give you a whole list of things like to work on to get you to the top five. It's pretty cool, man. Is If you haven't really deep dive into like AI, like ChatGPT, one of the chat boxes, I really highly recommend that, because that's going to be the future.
Yeah, of course. We've tested all the AI platforms to make sure we're ranking in that. We can actually get patients who come in saying, "Yeah, we found you on Gemini or ChatGPT." Um, it's interesting. I don't know how it's going to work, and we've picked the brain of our SEO team, some consultants, of how this will work. Because at the end of the day, the AI platforms, whether it's ChatGPT, AI, or Gemini, Grok, whatever it is, they're still dependent on Google and digital assets. They still look at sources, which are web pages, YouTube, Google reviews, to give their findings, and so there's still an intersect between the two. So I still think the investment into SEO, digital assets, podcasts, your name tagged everywhere on the internet, reviews, clinic reviews, is what's feeding AI and generating the results. So there's really no way to directly market into AI right now. You can't pay ChatGPT $10,000 a month to say make me rank number one. And I don't know if that will happen. I don't think it will happen, but I still think right now in my advice is that's why we're putting a lot more of our investment for marketing into Google and SEO, just because I think that's what's really driving these results in the AI chats or platforms.
I see. Yeah. Um, so as far as like, let's talk about a little bit about your practice itself. So I know what are your main services that you do? Like you do interventional pain. I mean back. You do a lot of like facet injections. You do disc injections and things like that.
Yeah, so our main focus and my main focus is orthopedics. So we do a lot of injections for the spine, for joints. We do, yeah, like you mentioned, I do facet injections, epidurals, transforaminal injections for select patients, intradiscal work, side joints, um, any joint, shoulder, knee, elbow, ankle, wrist, whatever it is, we do injections. Obviously, everything we do is under image guidance. So spine predominantly under fluoroscopy or X-ray guidance. Joints, just depending on the patient and look what we're trying to achieve, other usually under fluoroscopy or ultrasound, guidance, generally preferred for joints, at least for me. We also do a lot of general wellness, peptide management, IV therapies, um, and yeah, just like we talked about earlier, as patients come in and they ask for stuff, just adding different service lines and different offerings to our menu. We've in discussion of adding a lot of other ancillary services, but at the same time, we're trying to build a strong network of partners and people in the Miami area. And so, a lot of other stuff like physical therapy, hyperbaric oxygen, shockwave, things like that. We're actually just, I prefer to send out to other physicians and other practices in the area. Just because I think there's it's good to build relationships and have good people in the community to work with.
Absolutely. Now I know we kind of were supposed to talk a little bit about that new bill that so SB 1768 that passed in Florida. Um, for people that don't know or haven't heard about it yet, can you break it down a little bit on your thoughts about it and what it is?
Yeah, first of all, wow, I can't believe that went into effect. That's incredible. Um, Florida is not so. The bill, in essence, allows the use of stem cells for therapeutic use for patients, and it's obviously very tight and regulated. Right now, if you read the bill, and I think every physician who plans to use stem cells should read it letter to letter, page by page. But it's mainly for orthopedic use, pain management, and wound care management. Nothing outside of that. We're not the first state to pass a bill like this. The first state was actually Utah, which passed it, I believe it was last year or 2023. They passed it, and so it's been in effect there. And Florida became the second state. And there's several other states that are, in process of presenting this to legislation and trying to push this forward. Overall takeaway, it's great. It's great for the citizens of Florida, the people of Florida, the visitors of Florida to have access to this sort of higher level care. Right now, a lot of these clinics and treatments that people are able to get have to fly internationally to international clinics in the Bahamas, Colombia, Panama, Caribbean, wherever it is. So I think that being able to come to the U.S., a state like Florida, which already has a lot of tourism, may turn into medical tourism, and get these treatments is going to be great. Obviously, the flip side of that is, I think, as physicians, we need to put the patient first. We need to protect the patient. We need to make sure we know the products we're using. We're using it for appropriate treatments. We're not making false advertisements or claims just to get people in the door. And the right people need to be using the right products. And so, I'm hopeful the state of Florida will put in measures and regulations to make sure that it doesn't become the wild west of stem cells, and people are just doing whatever they want with them. But the right people are offering the right treatments.
Yeah, absolutely. I know there already has some regulations as far as like what not pharmacies, but where you can get the stem cells from. They have to be regulated by the FDA, and they have some. They try to have already some guidelines to try to minimize, people using, and they also put restrictions on what type of stem cells you can use. Right? It's not like you can use embryonic stem cells; it has to be umbilical cord, placental from live birds.
Yeah, I mean, I think the bill passed, and my understanding is, Florida Congress is out of session, but they're back in session in January, and when they're back in session, I think there's going to be significant amendments and things added to the bill as we move forward. So I just I think a lot of people are just it's a wait and see game. Let's just see how everything changes. I think it's obviously we're in the infancy of what regenerative medicine is in Florida and the United States. Future's bright though. Hey, this is the right step forward for everyone, to be able to get these kind of treatments that are offered around the world. And the United States now, just Florida specifically, kind of setting the bar for other states to come in and be able to offer the same for their people.
Yeah, absolutely. Do you see from your perspective? I know there's good things that come from it. Do you see any like what could go wrong with what's going on if it's not used properly? Or I think the bill also states only DOs and MDs can be using these procedures, right?
Correct. Yeah, it's only DOs and MDs, nurse practitioners, PAs, doctors of chiropractic medicine, physical therapy. They are not allowed to administer or use these medications, which I think is important. Um, you know, medical training is important. You and I both went to med school, residency, fellowship. We understand the level of education and training, and patient safety that we put into place for everyone. So I think it's, those tight regulations are important. What can go wrong? A lot can go wrong. People use this inappropriately. They're getting products from that are not Florida compliant per the bill. Infections, adverse events, immunologic reactions, all sorts of things can go wrong if you're not using the right product in the right way. Um, in terms of injection therapy, obviously you've done a sports medicine fellowship, you understand joint and spine anatomy, but just not anyone should be injecting into joints or spine. The risk of complications, injury are huge. And like I said, the right people need to be using the right product. And hopefully the state of Florida is able to regulate that.
Absolutely. Yeah. Yeah. I think we cover a lot of the things that I really wanted to cover. Now, again, kind of the main reason why I was doing this podcast is again to bring light to other medical professionals that they can also do it, right? Because people like you and I have made that transition. You have your own practice, your own business, and um, that limiting belief. Like I tell people, when I went back to medical school, it was meant my second career. I was a physical therapist for 8 years. I went to medical school at 32. And at the beginning, the reason why I didn't go right from undergrad is because I didn't think I could do it. I was scared of organic chemistry and the MCATs. And so I thought taking the GRE and going to physical therapy was a little bit easier because I didn't have to do residency, take organic and but I was never happy. I was never fulfilled, and I literally it took me 5 years of going back and forward, and I finally decided to make that shift. I was working at the hospital. Most of my friends were physicians, and I'm like, well, if you're a physician, you did it, I can do it too, right? And I'm like, so I just, I was like, you know what, I'm just gonna do it. Went back and I ended up doing it. So I took that leap of faith. And I think everything starts with awareness. Being aware that something has to change if you're not happy where you're at, and then also the getting over that limiting belief that most people have that they can't do it. And that's why I wanted to show with this show is like, hey, all these medical professionals are doing it, right? So can you, right? If you just set your mind to it. I know you didn't go through the W-2. You made that decision early on, which is good, but a lot of people don't. A lot of people, they have that fear, the one that they give out freedom. Not they give out, but they give out some freedom for stability, right? And a lot of people do that because they know, as being a practice owner, a business owner, you every day you have a million things in your mind, right? You're thinking about, okay, how we're going to get new patients into the clinic, how we're going to market, how we're going to work on SEO, how we're going to do this. It's not just, hey, I just need to learn these guidelines and see patients because I'm going to go to the clinic and I'm going to have a schedule full of patients. Like, no, I have to get it myself. Some months, how in the summer, I don't know that I'm there, but for us in the summer, July, it's a little bit slower. We live in an area which is a lot of snowbirds. So in the summer they're gone, right? So it's like you're just thinking about ways like, hey, how can I, let me take this time to try to make my marketing better. How we're going to market to more people to try to get more people in the clinic. So do you feel that all of these things that go through your head from the marketing, from the sales perspective, have made you a better and stronger like business owner, entrepreneur?
Yeah, I mean, a few things to digest there. First of all, Gil, I just want to say, thank you for making this podcast and spreading the good word, because I think platforms like this are very important to physicians who, I have a lot of colleagues who are in that W-2 rut, and, a lot of friends, school, residency, fellowship, who just, they're looking not necessarily for a way out, but for a change. They want something new, and they've being a physician is it's a grind. There's a lot of burnout. You see a lot of patients. You have 20 or 30 people's lives in your hands every single day. It's mentally, physically taxing, emotionally taxing. And so, the fact that you're making this podcast, bringing on like-minded individuals to educate and inspire other people, thank you for that. And I think it's very important. And, keep fighting the good fight, and everything will certainly keep trending in the right direction. The second part of that was, you know, I kind of mentioned it, I saw my attendings and residency fellowship, they were happy, they were doing well, but there's always a sense of like repetitiveness all the time of doing the same thing. And, as much as every physician prides themselves, we always try to do the best for our patients. When you get specialized, especially say interventional pain management or sports medicine, or anything, you're doing the same thing every day. It's the same conversations. It's the same seeing the patient, looking at imaging, giving a treatment option, and the same discussion, and you're doing it 20 or 30 times a day, every week, every month, every year. And that burnout can get taxing. So your question was like how to manage from a business perspective all these other hurdles and challenges and thought processes. And to me, now it's getting to be sometimes a little bit overwhelming, but at least when we started, it was kind of fun. It was something new. It was a new challenge, something to make my brain think about, oh man, I got to think about marketing. I got to think about payroll. I got to think about HR and bank accounts. I got to build out this EHR by myself that I've never done before. I got to build out Instagram pages and websites. And it was kind of, at least, that interest and curiosity sparks in the beginning when you build a business. And then as you kind of grow, you're able to organically hire individuals to kind of take certain roles, to fill in gaps, and then your focus kind of changes on how do I now grow this business? What are other strategies and meetings and communications I can do to really go to the next level? So for me, yeah, it gets overwhelming. It gets tedious. Staff member call. We're not some huge corporation. We're a small business. One medical assistant or front desk calls out, it kind of throws our entire day off, and then challenges come up out of nowhere. So it keeps you on your feet. But then it also, changes your mindset, your focus, so that when you do see a patient, you can really give them the attention, and know it took a lot to get that patient in your door, and you're kind of more grateful to see that person and offer their treatment and kind of give them the best care possible.
Absolutely. So, if you have to give one piece of advice to anyone who's listening, that again is feels stuck, like you said, you have a bunch of physician friends that are stuck in that W-2 grunt. Like, what's one piece of advice that you would give them?
Yeah, your life is in your hands. Your career is in your hands. You are an expert in your field. The majority of people are residency trained, fellowship trained, board certified. There's a lot of work out there. I think stability is important to some degree for people. Have families, have obligations. Yeah, money is important, stability is important, but don't be scared to take that plunge. There's a lot of people who've done it with no knowledge. You'll be okay. Um, Read a lot, watch a lot of YouTube, listen to a lot of podcasts, find mentors. And it's very easy to just pick up the phone and cold call people, and you may get rejected, but you may find an attorney or consultant or a doctor who's willing to sit there and talk to you for 30 or 45 minutes and give you a lot of sage advice and kind of just help you build. I think most importantly is like things don't happen overnight. It takes a lot of time. So, don't get stuck in this mindset that you have to build a successful business or practice in 1 month or 1 year. It's just, keep moving, keep grinding, and you'll get to where you want to be.
That's awesome. Yeah, and I know we didn't really talk about mentors, but I know you brought it up now. Mentorship is super important, right? Um, I have a mentor that says, "Listen, you either," and then sometimes mentorships, sometimes you have to pay, right? You have to pay mentors that have years of experience, like kind of like consultants, right? You pay for them, right? You're paying for their expertise. Because like one of my mentors says, like, listen, there's a ignorance tax you're gonna pay, right? You're either gonna pay for that tax with money by paying somebody that's already been through it. You got 20 years of experience and it can help you solve a problem in 10 minutes, or you're going to pay for it with time, right? You're going to bang your head against something for a couple of months or years and try to figure it out, but there's always going to be a price that you have to pay. And I think mentorship is something that I think everybody should look into, because there's so much. And the more I realize, the more you learn, the more you don't know, right? Because there's so much information out there and you can know it all, right? But you can find those consultants, you can find those mentors to like at least guide you through and help you solve problems when you get stuck that they might have already been successful at. So Oh, Anki, it's been a pleasure having you here on a Saturday morning. Thank you for coming into the podcast and sharing your journey, and giving some advice to people listening. If anybody want to connect with you, where can they find you?
Yeah, I mean, thank you for having me, man. I appreciate it, and I hope to see you in person soon. We saw each other a couple of years ago at that training, and hopefully we see each other again soon and sit down in person and grab a drink or some dinner. If STEMS Health, we're based in Miami, Florida. Hopefully our Google searches are working. So if you just Google STEMS, STEMS Health, we should pop up. And our website also is STEMS, STEMS health.com. And yeah, take a look. If anyone, hopefully no one's in pain or having any issues, but if you're in Miami and need some help, we're here to help, or, happy to chat as well.
No, actually, I'm always sending people. I am always like whenever somebody talks about, because I don't really do anything for the spine. I do all the other joints. So when anybody asks me, it's like, hey, I'm like, hey, if you want someone that's not just going to do steroids into your spine, and I always give me your information. But again, I'm glad. It's nice having you here and talking to you, and we'll catch up sometime soon.
Absolutely, man. Thank you for your time, and yeah, hope people listening and move forward and keep pushing forward. And failure is part of the process, but as long as you keep going, success will be there.
All right, all right. We'll talk to you later. Okay.
Thank you, man.